And there are encouraging signs that the nation is turning a corner in this pandemic. Cases are down in all 50 states for the first time since the pandemic started. New York is one of the many states that are dropping their mask mandates for vaccinated people following the CDC's guidance change. But Americans are scrambling to keep up with these updated rules. Joining us now for more on this is ABC News medical contributor and infectious disease specialist at South Shore Health, Dr. Todd Ellerin. So good to see you.
Good to see you.
So I want to start with this new guidance because it's causing a lot of confusion for people. What are your thoughts on how Americans should navigate where and when they should wear a mask?
Right. Even, you know, Saturday Night Live just did a parody on this, and it really is confusing. Why is it confusing? Because, first of all, you have CDC guidance, but then you have state guidance, local businesses, and then as individuals, how do we feel? And they're not necessarily all the same. I think some of the key, the key points that I want to make is, number one, keep a mask in your pocket if it's not on your face. I think that's very important because at some point you may feel comfortable, but maybe you'll get into an elevator with someone who's unmasked, and maybe you'll get uncomfortable and you want to put your mask on. You should be able to do that. The second thing, no mask shaming. That just can't be allowed. We have to allow people. Remember, as you know, your wardrobe is very important to you. You've been living with a mask, as have I, for the past 14 months or so. So it's become part of our life. Just because we are maybe vaccinated, we still may want that extra layer of safety, and that has to be allowed. The third thing I want to say is really the unvaccinated people who go indoors. I think especially in crowded areas, that's the biggest risk to them if they take their mask off and they're unvaccinated indoors. So I really do agree that at this point, you know, if you're unvaccinated and you're indoors, especially in a crowded area, you want to keep that mask on. The last point I want to make, Eva, is immunocompromised people, people with weakened immune systems. They really need to think twice before taking their mask off indoors. Why? And this is even if they're vaccinated, because they may not respond as well to the vaccine.
That's some good advice and a good reminder to all of us to have patience with each other as these rules are changing. I'm curious, has this guidance changed the way that you yourself are approaching wearing a mask?
Right. So good question. Remember, I spend, most of my day in a hospital. So the answer is no. I'm masked, throughout the day there. And then I live in Massachusetts, and the Massachusetts state mask guidance hasn't changed yet, but it is going to be changing towards the end of the month. So I do believe that I'll be wearing a mask because I'm fully vaccinated. I will be wearing a mask less often. But again, I'm going to be keeping that mask on. I'm going to be keeping that mask in my pocket.
Yeah, and it's a good thing to have it in your pocket. You just never know how you're going to feel, right? So I want to ask you about these breakthrough cases, because we're starting to see that. Vaccines are supposed to decrease transmission, but right now we're seeing an outbreak with the New York Yankees. At least 9 fully vaccinated members of the team, a mix of coaches, staff members, and 1 player have tested positive after receiving the J&J shot. Their infections are mild or asymptomatic, but it does raise the question, are these outbreaks still going to happen?
Yes, and the most important part of the story is that most of the Yankees were asymptomatic or mild infection. Remember what we talked about. Some of us have said before, even if we don't reach that herd immunity ultimately, even if we can't eradicate this virus, hopefully we can turn into more of a flu or even a common cold, better yet. And that's very possible. I think that's what we're seeing. Eva, what I want to remind you is that in the phase 3 Johnson & Johnson clinical trial, the rate of asymptomatic infection, the reduction in the vaccine group was about 66% or so. So, which is very good, but it's not perfect. So people are still getting infected even in the vaccine group. That's true of all the vaccines. Are there differences over time in the real world? We'll have to see. But I think that's what we're seeing. But I think the most important thing is when you're vaccinated, you tend to have a lower amount of virus, so you're less likely to transmit.
Also, given this new CDC guidance, more states, as you mentioned, are dropping their mask mandates. So for parents, what should they do with their unvaccinated children? Should parents with unvaccinated kids be concerned that their children are more at risk? I've heard a lot of parents discussing this recently.
Right, and I think that gets back to our first question, which is, I'm not going to tell parents how they should feel. As parents, we're going to feel differently depending on our level of risk tolerance, perhaps whether our child has a weakened immune system or other comorbidities. So I think, again, what's important is to make sure that when you send your child out, if they're old enough, that if they're not wearing a mask on their face, they should have a mask in their pocket. And then also know, sort of what the local guidance is around if they're in sports, or, what the state rules are or the school rules. And this is all going to be changing and evolving over time. But I think as long as we get as many kids vaccinated as possible, remember, that's the real shield, that protective shield. So what I would say to parents is, please try to get your kids vaccinated if they're age eligible, at least age 12 right now, and keep that mask in their pocket.
Vaccinating kids gives a lot of parents anxiety. Only 37% of the country is fully vaccinated. And I've spoken to a lot of people who say they just want to give it a little bit more time. They want to wait and see what this long-term safety data says before they, as adults, even get it. What do you say to those people who are still, at this point, feeling pretty hesitant?
The first thing I would say is it's okay to be vaccine hesitant. That makes sense to me. I get it. We're still early on. The vaccines have been out, in the real world for, well under a year. But so far they look very powerful, very safe. And what I would say to them is, keep asking people in your life that you trust, like your child's pediatrician or your internist or family practitioner, perhaps your obstetrician or gynecologist. Keep asking. Don't give up on it. And the other thing is that what I don't want to see is ultimately what the headlines are going to show is that the vaccinated groups are going to be less likely to get infected and in the hospitals, and the unvaccinated people who acquire COVID are going to be more likely to get hospitalized. Again, we're seeing cases going down right now. Things are going in a great direction. But I think we expect to see more virus again in the fall and in the winter. I just don't want to see the unvaccinated individuals just be kind of lacking that protective shield that lands them in the hospital or loved ones that we could have protected but didn't. So I just want people, don't give up on this vaccine. Keep asking the questions.
Yeah, and if you are hesitant, you still have time. You can get the vaccine at some point down the road when you feel comfortable. Dr. Todd Ellerin, we always appreciate you. Thanks for joining us.
Take care, Eva.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.